or any hospital for some of these alternatives to ACA. Cash networks, and this is where Larry Williams comes. I've known Larry going on 3 years, and Larry is an ex-city council member for St. Petersburg. He's an innovator, he's an entrepreneur, and I sat down with him 2.5 years ago. Dr. Rosenquist, who's part of our expert panel as a radiologist. But Larry came up with something that is absolutely necessary. And what that is the cash network. You can go to the next one. There's also discount plans available. Click on the next one. And then flexibility to upgrade. We're going to talk about that. But we're going to get into what Larry is doing. We have a specific screen to that. But I'm excited that you're here. The discount plans or associations, yeah, absolutely, that's an alternative. It's really not insurance because they have different things that are in there. You don't have to be licensed agent to sell it, which we are all licensed agents that are talking to you on the insurance side. Flexibility to upgrade, this is amazing, and I'm going to show you a slide that talks about that. So this says we need healthcare options, not obstacles, okay, and that's what we're starting to see next. Can you go to the one screen, the puzzle piece? Because I think I want to do that. We can go back. All right, but stop there. That's fine. So the next one, yeah. This is Larry Williams' brainchild. So he started, and it's a hub and spoke model, which I'm very partial to hub and spoke models, is the Affordable Healthcare Network. So if I have an ACA plan, and there are some plans that you can get that you're prepaying for low deductible, zero deductible. It depends on what is cost prohibitive or what you're able to do. But some of those plans I've seen them over $2,000 a month. Is that true for a family of 4 or 5? Absolutely. So I don't know a lot of people that can afford $2,000 a month for health insurance. So what Larry came up with, and his son Matt and his son Chris, and there's a host of other people, he went and he talked to the podiatrist, he talked to the optometrist, he talked to the insurance agent, he talked to the imaging consultant, which he owns, Docs MRI. He talked to urgent care, and he found all of these people had the same issue. And where there's adversity, Larry knows, and I know, there's opportunity. And the adversity is you have a radiologist that is not getting paid for 6 months. That's a problem. It's a big problem. Or you have someone that's chasing, and in the case of Larry Williams, he had 5 girls that you were paying about $50,000 a year chasing your money down, right? And what he thought was, well, wait a second, what if I got rid of those people that were chasing my money and then just took cash for that and got paid today? And at first, a lot of people that he went to, he goes, that doesn't work. And then he sat down and he showed it to him, and then light dawns on marbled head, as we say in Massachusetts, that you're able to get paid today and not have to worry about getting paid and getting short paid or not paid at all. Because there are some instances where you just don't get paid, and we don't want that to happen. So can you go back to where we were before? That's fine, right there. So if you have alternatives, many people have decided to opt out. And this is one of the things that we talked about, the $95 penalty. Well, it's $95 or 1% of your gross income. So if you make $100,000, then you can figure that out based upon the tax. Now, another thing that's in the law, which a lot of people don't understand, is if you don't get a refund, legally, they can't tax you for that. So one of the things that we're doing is making sure, as an alternative, that is considered a it's not qualified. And some people are like, whatever it is, I don't want the ACA. And again, this is what other business people are telling us. That's okay. For sidestepping the individual mandate, it is 3 years ago, there are companies that were going the complete opposite direction of what ACA was doing because they knew something was going to happen, or they were hedging their bets, and it worked. So they got approved, a lot of these in 44 states, these alternative plans that are enabling small businesses to pay about 1/3 of what they would with a Blue Cross or an Aetna or Humana. Those are the big 3. Everybody else is kind of fighting for crumbs. Blue Cross is the behemoth for sure. Aetna is second, Humana is third. But a lot of people are just saying, I don't want to do that. Well, first of all, it's cost prohibitive. Second of all, I don't mind paying the extra amount. The other thing that they're doing is looking at just the catastrophic component. So one of the comments I heard was, you cover your aspirins, we cover your assets. So the small stuff, that's where Larry comes in, as far as doing 3 lab blood draws and lab work for $100 with one of his cash partners. Getting an MRI for $275, and I've even seen it lower than that. Getting a mammogram for $60. Now they're saying, okay, I'm not paying $2,000 a month for this insurance, that I have a $6,300 deductible. I'm paying about $400 a month for the insurance. But Eric Ross, or my team of experts, have found a way for me to lower my out-of-pocket by being able to pay cash and make sure that the catastrophic piece is taken care of. Because at the end of the day, like I said, we have insurance to protect ourselves and to protect our assets. Next. I was in the military for 8 years, and that's our slogan, is improvise, adapt, and overcome. And where there is, as I said before, adversity, we create opportunity. So alternative insurance plans, they do have a place for healthy Americans. Now, I'm not saying that this is the whole point of the objectivity. This plan will absolutely work great for some people. The last time I was in the hospital, Nixon was in office. When I do get sick, I don't go to the doctor, I just take care of it and I eat healthy or what have you. So for me, this alternative, this is a plan that I have myself, but for someone else, it's not. So that's where Brian would come in. That's where our MedSup or asset protection expert would come in. So it's important that you understand that this isn't made for everyone, and that we have a core plan that a lot of these companies are putting ancillaries around it to protect against the gaps. Next. So as far as the policies paying cash, so if you spend one night in the hospital, the average hospital stay, this is per Blue Cross website, is $2,200 for you to be in the hospital. That's what it's going to cost you. And the biggest thing is whatever the network you have. A lot of people look at this and I say, I've never heard of this organization before, but the hospital or the doctor or the person that's in the front, they look at the network. What network is it? Is it First Health? Is it multiplan.com? Is it PHCS? And these alternatives have some of the largest networks in the United States. Cash doctors, again, going back to Larry, we want to have them to retrain their imagination as far as this is not my grandfather or my father's health insurance plan. It has to change. In 1491, the general consensus was what? That the earth was flat. So is there a learning curve for people to understand ACA and their alternatives? Absolutely. That's why we're doing this. So if you're able to have different things such as the cash, and then you couple that with telemedicine, and this is huge. Talk about living in the 21st century. We had a meeting about telemedicine, which is legal in the state of Florida. 83% of all the calls that come into telemedicine, which means that's CallMD, that's Teladoc, these are the actual names of these organizations, 83% of the calls that they get can be ameliorated over the phone. And whatever that is, whether it is a Z-Pack, it's some kind of erythromycin for a child that has a virus, then that can be sent over, and in some cases, in most cases, it's just a one-time monthly fee that they pay, but it's unlimited. So instead of you bundling up all the kids, if you are a husband that has children or a wife, you can, at 3 a.m. on Christmas Eve, get a hold of a doctor, have that doctor call back and take care of that. So again, if we're living in the 21st century, let's use 21st century technology. And then generic prescriptions is another piece, and that is some of the things that we have been finding when you've been doing this as many years as we have. There's only a certain number of things that people are concerned about. And I'll ask them, how do you use your health insurance? What are you concerned about with your health insurance? And they all say the same thing. It's a catastrophic. Remember Christopher Reeves, Superman. If you look at the total number of his bills, it totaled over $5 million. So that's why EHB is in place to be able to take care of that. So we talked about the power of the cash network. And now we're going to go on to the pros. So subject to naked insurance, and naked insurance, it's not on all ACA, but there are some plans that you have to come out of pocket the amount of the deductible before anything is covered other than wellness visits. But there are some plans that have co-pays for emergency room, co-pays for outpatient. It's just a little bit higher, so you can do that. Huge national network that is readily available. Like I said, PHCS, these are Cigna PPO, they're huge in the top 5 for sure. Rate guarantee for up to 36 months. What that means is you're not locked into a contract. It's just that whatever you do in 2014, you will be paying the same price in 2017. Predictable benefits for, so CI is critical illness or accidents, so that you know, and the agent that has these that are ancillary to the core will explain to you how that is predictable. Typically lower premiums, I've seen them on average up to 1/3 of the cost. And then this is a very powerful thing, because a lot of people ask me, well, that's great, but the concern I have is what happens with this limited plan that has a cap on it, where EHB and ACA, there is no cap. So $5 million, if you have a $5 million bill, you're close to being dead or you're going to be dead. I mean, that's just the way that it is. That's a lot of money. Haven't actually seen personally, I've seen $1 million bill in my 30 years. So what this rider, there's a rider that enables you to go from that alternative with no underwriting into an EHB plan. So you have a alternative to the ACA that you are able to have a puzzle piece that bridges the gap between an essential health benefit, and I'm going to use Christopher Reeve again. So Christopher Reeve has a alternative to the ACA, and he has the equestrian accident, but he has this rider as part of his plan. He immediately, with no underwriting, goes right to an unlimited essential health benefit plan, which is very powerful. And the analogy that we like to use is in Florida, and we're still in hurricane season, it's like getting hurricane insurance, which I didn't have before, as the roof is separating from my house. That's what this is. Cons, because we want to be transparent, that's what this is all about. That there are potential gaps in the system, but we want to make sure that you understand what those percentages are. There's someone that works for, and they're highly paid insurance companies called actuaries. And actuaries physically, they figure out the algorithm or the percentage of times that you're going to have something that's over a certain amount. Let me give you an example. $100,000 in fees for an individual. If you were to guess, would you say that what percentage of the time would someone in 2013 last year had a claim that was over 100,000? Does anybody have a guess?
1%.
1%? Anybody else?
0.5%.
0.5%. It's 0.1%. So very good. And that's the attorney back there. So
I had to
yeah, it's like Jeopardy or Price is Right. 0.1%. So the other question that I ask people for Blue Cross, for Aetna, for Humana, is $100,000 a lot of money for large companies like that? It's not. I tell them they find it in their couch cushions. They collect millions of dollars hourly in the United States for health insurance. So we want to make sure that if there are potential gaps, that we have that EHB piece, that the alternative to that has the ability to step you up to an unlimited plan. The negative stigma attached is due to lack of education, because a lot of people assume things that aren't true. They read something on the internet, and is everything true that you read on the internet, Larry? I'm just curious.
Sure, I believe it.
It's not. I mean, everybody can put anything on the internet. I think that due diligence and having someone that's an expert and has the passion that we do, because we're passionate about what we do, most people would rather watch grass grow than talk about or even hear about insurance, but it's something that I really enjoy. Not all alternatives are equal, and that's the bottom line. I think it's important that you as the consumer and as a business owner take all of the information that's out there so that you can make, predicated on all that information, the wisest and the right, not the best. Remember, that doesn't exist anymore. The right decision for your family, for yourself, and for your employees. It's critical to pair these core plans with the ancillaries. That's accident protection. That's a card that gives you access, just like Sam's Club or BJ's. We have these cards that you can go to any of these vendors and get a reduced amount. So instead of you paying, Larry, is it obscene for me to say that there's some hospitals or doctors that would charge $1,400 for an MRI? Is that off base?
No, I have a sheet here, but $1,500 is actually pretty conservative, more around $2,000.
So let's just say $2,000 for an MRI, and if I have this card, which grants me access the same way that I go into BJ's, Costco, or Sam's Club, now I'm leveraging what we call economies of scale, the law of large numbers. I have a bunch of people that are paying a small amount to have access to this wonderful card, which does what? Again, it's driving my out-of-pocket expenses down. So let's look at an ACA, a real-world example of an ACA bronze plan. Again, there's absolutely times that the alternative is wrong and ACA is right and vice versa. Let's talk about a small business owner for both sides. Has 2 kids, pays $1,200 a month, which is a 60% increase over the last few years, and they don't have a guarantee that it's going to go up any further. So if you just do that math, they have it's the bronze plan, so the maximum, Brian, correct me if I'm wrong, out of pocket for the family is $12,000. That's the cap.
Yeah,
12,600, okay? So I rounded it down. And the father has a hernia surgery, which I know because we've seen a lot of these lately for some reason, a lot of hernias out there. It's about $13,000. Now that's the retail price if someone doesn't have insurance, is $13,000. The daughter breaks her leg in the same year, and that's with x-rays. They set it and put a cast in it. It's $5,000. So the total spent on the deductible and the premium for an ACA bronze plan with these 2 scenarios is $26,000. That's the insured's out of pocket. That's the premium plus the amount of money that the father's paying for the surgery, which is about